Hi, class. It's Kristen. Hope you're all well and are enjoying your spring break. I wanted to take an opportunity to answer some of the questions that you posted on your discussion post a week or two ago. I'm not sure. Can't remember because it's spring break. And I have a visitor here, and who is also a counselor educator.
That
and
is true.
Yes. And I wanted to get some of her thoughts as well. So, would you introduce yourself?
I most certainly would. My name is Pam Wells, and I'm an assistant professor at Georgia Southern University in beautiful Statesboro, Georgia.
Exactly. Yes. And Pam does not have a southern accent, even though she lives in Georgia, because she's not actually from Georgia.
That is correct.
Where are you from?
I'm from the beautiful, great state of New Hampshire.
Excellent. Not Arkansas. Okay, so we're gonna try to remain serious because Pam is actually visiting me for the ACA conference in San Francisco. She's going tomorrow, and then I'm heading in on the weekend. And so we thought this would be a good opportunity to see each other because we're dearest of friends, and we're having a good time. Because Pam is an excellent babysitter. No, I'm kidding.
That too.
But anyway, let's get to the reason that you're all watching.
Oh yeah, she said she was going to answer questions. Yeah.
Okay, so the first question that I was going to answer was, what things do you, I'm sorry, I'm losing my words. One of you asked, I would like to know the things you wished you would have known or what surprised you the most about working with children.
That's a great question.
And adolescents as well. And I'll go ahead and start and give a couple of my thoughts. We were talking about this today when we were prepping as we were walking. And I talked a little bit about how I was surprised at how I knew I would get attached to the children that I worked with because that was kind of my personality. And I was worried about that, like, what am I going to do? Because I'm going to get so attached to these kids, and then I'm not going to be, they're going to be going back into situations that are hard. What am I going to do? But what really surprised me was how attached the children got to me. And sometimes that was a little bit scary for me. Then it made my attachment to them even more difficult because I felt like all those things came up for me. Like I felt like I'm going to be disappointing them. I'm going to be, really putting them through a tough time, especially when I was like switching jobs or switching when I was in school, switching my internship. And so I think that was really important. And that's where boundaries were really important in making sure that the child, if they were old enough, well, not if, but the child at their developmental level knew what my role was. And anyway, when they just run in and give me a big hug, being very careful about how I handled those types of situations. That was one thing. What about for you, Pam?
I think, you touched on it a little bit. What I wish I had really prepared myself for was recognizing that some of these kids have gone through really significant traumatic incidents, and sadly, we're sending them back into not great, sometimes unstable situations. And in situations where the kids don't feel supported, it can feel just heartbreaking knowing that you're sending them back into a situation that isn't always healthy. Yeah.
It's really tough. And I think I was telling you earlier when we were talking about that I had a supervisor tell me, and I think I've told some of you guys this, or that, it's two things that can help with that are to think about. One, you're giving the child a model of a positive relationship, and hopefully instilling some coping skills that they can utilize in the environment, although not perfect. And then remembering that counseling does work and that you're giving them a positive experience so that when they can choose, especially if you have like a parent that pulls or a caregiver that pulls their child out, if you give them a good experience of counseling so that they have a memory of this was a positive experience, then perhaps when they can choose, or at a different time in their life when their family or caregiver is more open to it, whatever, they can say, I want to do this, and they can choose on their own to go back. So
Agreed.
those are words that, especially when I was working with child sexual abuse, that I had to really live with. Like, this doesn't maybe seem like it's making a difference right now, but well, I have to think long term.
Yep.
That's, and let's see, there was another couple of things that I wanted to say. One was always expect the unexpected. Like, I remember it was like almost boring, some of the sessions that I would have with kids, and then all of a sudden, you know, they would play something out that was really, you know, meaningful, and because, you know, I use play therapy with the younger kiddos, or I would have, I had some adolescent clients that, you know, just wanted to talk about their friends every week, and then, you know, suddenly I get a phone call that they've run away from home, and I had to help figure out how to handle that scenario with the grandparent at that time. So just things like you don't know. I mean, you just never know. So expect. I think our reading talked a little bit about that, especially when working with challenging adolescents that expect, you know, crises. Oh, and then we were also talking about remembering. Go ahead, because Pam's teaching psychodiagnosis at her university this year, and she said that she always tells us to her students about diagnosing. You remember what it was?
Oh yeah, I think it's important to remember that there's a reason that a lot of our diagnostic criteria are not really applicable until people are 18 or older, and it's because if you look at some of these criteria, like personality disorders, if you look at the diagnosis criteria for personality disorders, almost any of them, you can look and say, that's like every teenager I know. Okay, maybe not antisocial, but you know what I mean, like histrionic and borderline, and some of those narcissistic personalities. I mean, it's like, oh, I know her, right? So it's important to just really recognize that and know that a lot of times, adolescents especially, like it's important to that kiddo at the time, but it's a lot of drama, right? If you think back to when you were that age, you might have noticed that in yourself or in your friends. So it's important to remember that our clients are struggling with some of that stuff too.
Yeah, and I was thinking, I lost my train of thought a little bit, but like when you are thinking, you know, developmentally, that it's really important to remember that, okay, that week, this would happen a lot with my adolescent clients. That week, it was like so dramatic. They broke up with their boyfriend and girlfriend or whatever at the time, and that they were, you know, at the depths of despair. And so I would be thinking, like, I would get all this stuff ready for the next week to talk about, or activity or to do or something. And then the next week she would be like, or the, you know, like,
I already have someone new.
Remember those ups and downs, and you can't have a plan, especially working with kids. And I mean, I don't even think that really works with adults most of the time. But like having a plan, you know, sometimes in school counseling that looks a little bit different. But overall, having a plan, normally your plan gets changed. It's not sometimes to have a plan if it helps you to feel better and relax yourself. However, it's not necessarily going to happen in the session. and so that's really, and then the last thing that I wanted to talk about was, like, I was surprised at actually how many parents did want my input.
Oh, yeah.
And did trust me and did listen. Like, I just was very prepared to go into I don't have any kids, I'm only 24, you know, when I was starting, and they're not going to listen to me or care what I have to say. And that was not, I mean, sometimes yes, but overall it wasn't necessarily the case. They really did kind of respect me in the role that I was in, and ask for help. And so it's really important that I want to convey to you is to not project that.
Right.
Like that fear going into it. You're going to feel it on the inside, but project as best you can. Confidence. And I know you guys know a lot more than you think you do. And
absolutely
remember that you know a lot more than you think you do. And to always include the family. And I think Rebecca has gone over that probably with you and Practicum and Allie as well. And Practicum, that if you're working with child and adolescent, involve the caregiver, involve the family as much as they will allow themselves to be involved. Check in. I do check in with my parent or my family members either 5 or 10 minutes at the end of every session or about every 4 sessions. But I'd always set it up ahead of time so everybody knew the kiddo and or the adolescent or the family member. They always knew when I was going to be doing that. Anything else that you have to add? So most of all, just take a deep breath. Trust the skills, even though they seem weird.
I agree.
Even though they seem weird. And then if you don't feel like you're doing anything and you're sitting in session and you're maybe a little bit bored because you're just doing tracking, it's not necessarily the same kind of boredom that you would use like with some of y'all's work, or like thinking about transference or countertransference. Like feeling bored isn't necessarily that means that something is, it just means like maybe you're not as engaged in what the child is doing, and that's hard. And so how can you engage yourself in them just picking the toy